Welcome back to News Talk for this half hour. I'm joined by patient advocate Dr. Stephen Cusin, and today we're going to be talking about MS and how it's what you described the area kind of a hotbed or hotspot for MS.
That's the myth. Multiple sclerosis is a common disease. It's common in women, white women, childbearing age, and it's a combination of autoimmune, genetics, and environment. When it comes to the environment, there's this thought up here in central New York that this is a hotbed for it. I spoke with a great resource for people with MS who's in Syracuse. It's the MS Resource Center, and they have activities here in Utica. And Smil, and she said it's anecdotal. It's more folklore than medical law.
Ah, okay.
But when it comes to MS, it is common, it is debilitating, and it's important to know that there is more in the north than there is in the south. We here in latitudes far higher up than Florida, we have 3 times the incidence of the disease. So there is a relationship with latitude. A lot of people think it has to do with sun. Low sunlight, low vitamin D levels. And so people look at vitamin D levels up here in central New York, and yes, they're low, and a lot of people take vitamin D. And the studies about multiple sclerosis show that women who take vitamin D have half the incidence of it. It cuts the risk in half. So vitamin D becomes important. Vitamin D up here in central New York is not a bad idea for other things that we get because of high latitude, low sun. Even on a sunny day, no one's getting a tan up here. So vitamin D levels are low, and it causes seasonal affective disorder, another debilitating problem where people at this time of year kind of get really depressed.
Now, you were saying that, and I was just about to ask, but you may have already answered that question there with seasonal affective disorder, but are there any other things that you mentioned vitamin D could help stem off, aside from MS and seasonal affective disorder? Are there some other things that are location-based that we have to be worried about?
There are a lot of things that are location, either by the environment and toxins in the environment, or local industries. We used to spew all sorts of stuff when we were a mill town into the water, and there was heavy metal disease. And there's environment that's related to things that are unrelated to sun, gravitational fields when you go further up north. So the environment plays a role, but it's complex. If you leave Utica when you're 5 years old and go down south, the risk won't follow you of MS. But if you leave when you're 15 years old, the risk follows you all the way down no matter where you go.
Because of how long you've been exposed to all of that?
How long you've been exposed, what it's done to your brain, the effects of the environment on the genes. So it makes a real difference.
We have a map here as well. This looks like
yeah, there it is. I mean, we're in a high-risk group, and you can see the further north you go, the farther north you go, the higher the risk of it. Now, and, you know, it's significant.
Now, looking at that map, and you see, in South America, they're in the probable low risk phase there. Can that be, their low risk be attributed to how much sun that they receive?
That's it. It has to do with distance from the equator, and they certainly get a lot more sun there than we're getting now.
Now, where does the line go between getting sun, getting too much sun, and causing yourself other problems?
Well, too much sun, of course, especially when you're young, may increase the risk of later problems like skin cancers. Most skin cancers, except for a couple, are usually pretty innocent. So the idea in the wintertime, when vitamin D levels are low, is to supplement yourself, especially for seasonal affective disorder when people feel a little low. Sometimes I want to pop vitamin D like breath mints this time of year in mid-February. And I brought some extra for you. In case
well, thank you very much. We'll pass them around in the newsroom, too, while we're at it.
They'll probably need them more than us. But it's a matter of knowing when it's right to do, knowing simple things like vitamin D. People sometimes use ultraviolet lights in their home and let them hit their face to increase vitamin D levels. But MS, coming back to MS, it is a disease that's hard to diagnose. It's frequently misdiagnosed because it's relapsing and remitting. If a woman, childbearing age, has visual problems or eye pain and it goes away, you're not going to do much. But if it recurs, then it's spinal taps, it's MRIs, and the treatment for the disease. And I see a lot of it at the Shared Decision Center where people want to know, what should I do? Is it steroids? Is it plasma replacement? Is it new biologic agents that are very risky? So it's a real problem, but the good news about MS, the reason that I was asked to chat today, is that from the time of diagnosis to the time people need a cane, can be up to 30 years.
So that's a lot of time to try and get in there.
A lot of time to hope for improvements in therapy, and improvements are coming down the line. But in central New York, not only do we have to cope with bad weather, we get MS, we get depression, you know.
Well,
we get a lot of falls and injuries.
Well, hopefully now after this we can do a little bit more to try and build our immune systems and try to stem that off. We're a little out of time, but as you know, as we always say, you and I could chat for a whole hour here.
Good to see you,
Dr.
Dave.
Stephen Houston,
Good
thank
to
you
see
very
you.
much. We'll be back right after the break.